Hello everyone. In today's topic, we shall be discussing about distraction osteogenesis, which is a very important topic in oral surgery. So let's begin with the topic. So the definition, distraction osteogenesis is a technique of biological process of bone lengthening which is a technique of biological process of bone lengthening in which osteomatized bone is moved apart by slow, continuous, incremental distraction forces, and there is a new bone generation between the two separated bony ends. So this is an alternative to orthognathic surgery or orthognathic procedures, in which the orthognathic surgeries cannot be done, or there is some medical due to some medical condition of the patient, it cannot be operated. So a distraction osteogenesis can be used to correct the jaw discrepancies in those kind of patients. So in this, along with new bone formation, there is a regeneration of soft tissue, which includes skin, mucosa, muscles, and new vascular tissue, which is the benefit of distraction osteogenesis. And the soft tissue regeneration is known as distraction osteogenesis. So distraction osteogenesis why it is preferred over orthognathic surgeries. So it will be preferred in pediatric obstructive sleep apnea, transverse skeletal discrepancies without extraction or proximal stripping, segmental defects, and irradiated cases wherein excessive surgical procedures cannot be done. Okay. Then the advantages of DO over orthognathic surgery is that it's a safer surgical technique. It decreases the length of hospitalization and can be done at a younger stage or younger age of the patient. It not only does the bone growth, but also is associated with soft tissue growth as well, such as the muscle and mucosa and skin will also grow along with the lengthening of the bone. So it gives more aesthetic appearance. Distraction osteogenesis may be classified as monofocal distraction osteogenesis, in which after surgical osteotomy, a distraction gap is created between the two bony ends, and this is a conventional approach for lengthening of bones. Example, in cases of mandible hyperplasia. Then there is bifocal distraction. In this type, a continuity bone defect in a bone is managed by filling the defect with moving a piece of the bone from one end of the defect to another, and this moving segment of the bone is called as transport disc, and this approach is used for mandibular reconstruction after tumor ablation. So these are the two basic types of distraction: osteogenesis, monofocal distraction, and bifocal distraction. So this was the basic introduction to distraction on osteogenesis. Distraction osteogenesis basically has 4 stages. First one is the osteotomy, in which an osteotomy cut is made at the at a desired space and a gap is created, and this stage is followed by a latency phase, in which the gap is left and the bone is left for around 1 to 7 days, and then after that, then there is a distraction phase. Distraction phase may we have 2 steps, that is rhythm and rate. That in this stage a distractor is attached. In after the osteotomy is done, the distractor is attached, is placed at the 2 ends of the osteomatized bony ends, and then the latency period follows for 1 to 7 days, and after the latency period, then distraction forces are applied. The distraction forces can be divided into two phases. One is the rhythm of the distraction force, and the other one is the rate of the distraction force. Then distraction force. After the distraction phase, the basically the rhythm of the distraction is the one the distractor is activated by 1 millimeter in one day, and it is activated twice. So for one rhythm, 0.5 mm activation of the distraction will be done, and it is done for 1 mm in one day. This phase is followed by the consolidation phase, in which the after the slow growth of the bone along with the soft tissue has occurred up till a desired lengthening of the bone, then this stage is maintained by applying by keeping the distractor in its place, so that there is remodeling of the bone, and the woven bone becomes matured bone, and there is remodeling of the bone occurs, and the stage is stabilized. So these are the four basic stages of this distraction osteogenesis. It is done in cases of facial defects such as facial skeletal defects such as mandibular hyperplasia or maxillary hyperplasia, or in cases where there is resection of the bone has been done, followed by a tumor surgery or a cancer surgery. So this is why these are the advantages of distraction osteogenesis. And then, apart from these stages, the distractors can also be divided into external distractors and internal distractors. External distractor is the one which is applied from the outside of the face or outside the bone, and it can be seen. So the problem with the external devices are that the patient compliances is very less, and it is not very aesthetic, and the patient does not cooperate. Whereas, and there are higher chances of infection in these uh, in the in if you are applying external devices, external distraction devices. But whereas in internal devices, the patient compliance is more and patient acceptability is more, and there is less chances of infection, but there is requirement of a secondary stage surgery in order to remove the distractor. But in external devices, a secondary stage surgeries are not required. It can just be removed by removing the screws of the distractors from where it has been it was attached. So these are the two types of distractors, distractor devices, distraction osteogenesis devices. So this is all for distraction osteogenesis for now. I hope this was helpful. Thank you.